So hopefully that worked. Yes. All right. So for tonight's session, we're actually going to record the first part of tonight's tonight's meeting because we have a guest speaker. Liam, I'm going to butcher your last name. I hope I pronounce it right. Doherty?
Yep.
No. Oh, or was that right?
Yeah, like Shannon Doherty.
Yeah, okay, perfect. So Liam is from Planned Parenthood, and I had asked him if he could give us some information about LGBT services that Planned Parenthood does, because I know that's a topic that a lot of people ask. I get asked that at least a couple of times on Facebook. People message me what services or providers are out there to help LGBT folks, and kind of what health services or programs are there. And so we have Liam here from Planned Parenthood to talk about what their agency does and what specific services. So I'm actually going to record that part of tonight's conversation or presentation so that we can have that and share it with other members and post it later on onto our Facebook site. Liam will be with us for the next 30 minutes or so. So if you guys have questions for him, feel free to ask him. But I am going to turn it over to Liam now, and thank you for everyone for joining us.
All right, thank you. Welcome.
Thank you. Thank you for letting me come and take over some of your time. I love talking about my work and Planned Parenthood and all the awesome stuff we do for diverse communities across Western New York. The affiliate I work for actually goes all the way from Buffalo, Niagara Falls, West Seneca area to Syracuse. And we have tons of clinics between here and Syracuse, but I'm going to be focusing mostly on our Western New York clinics. So Buffalo, West Seneca, Tonawanda, and Niagara Falls. And I'm going to share my screen, I think. All right. Can you guys all see a purple Planned Parenthood services?
Yep.
Our mission at Planned Parenthood. Planned Parenthood of Central and Western New York provides high-quality, non-judgmental reproductive health care, protects and supports every person's right to make voluntary, informed decisions about their sexual and reproductive health in order to lead a healthy and fulfilling life. Planned Parenthood of Central and Western New York protects and provides healthcare and education that empowers individuals and families with respect, without judgment, no matter what. And so at Planned Parenthood, we break down our services into 3 different categories. We have our health services and our clinics. We have our educational services, which is what I do. I go around and I talk to people of all ages about safer sex, birth control, LGBTQ inclusivity and rights, Planned Parenthood services, all sorts of stuff. And then we also have our advocacy side, which focuses on, protecting people's rights to reproductive health care in all sorts of times. So who do we serve? We serve everybody. Most people think of us as like a women's clinic for heterosexual women, but our services that we provide are for people of any age, any sex, any sexuality, any gender. Here are our clinic locations. So we have one on Main Street in Buffalo, right on Amherst Street and Main Street at the corner. There are several buses that go to it and a subway. We have our one at 750 Portage Road in Niagara Falls, right near like the Arby's, in the Arby's parking lot. We have one Webster Street in North Tonawanda, which is my favorite clinic. It's one of our smaller ones, but because it's smaller, it really just is a very great clinic to use. And it's right on the canal, so it's a really beautiful area right around that clinic. And then we have one in West Seneca over on Center Road. This is our website. This is actually an older picture of our website though. Currently, because of COVID, we changed our website to have more information about how Planned Parenthood is dealing with COVID. But if you go onto our website, ppcwny.org, you have access to tons of different information about the services we provide, educational resources we have, along with how we're dealing with COVID to protect our patients. And one of the really cool things we're doing with COVID is we've, because they've relaxed the rules for using telemedicine, we've been able to expand our telemedicine services that we provide. So now almost everything we provide at Planned Parenthood can be done through telemedicine. And so what are those services we provide? Obviously, like birth control, we have birth control for anybody who wants it. We do breast exams for breast cancer. We do annual exams for, like, we call them well woman exams, just to check and make sure the vulva, the vagina, the cervix, and all that stuff is okay. Pap smears, colonoscopies, things like that. We give out free condoms, and you don't even need to come in for free condoms. At all of our locations, right in the front door, there's a box of condoms. You can just grab a handful and walk away, no questions asked. We have both external and internal condoms. So I don't know if you guys have ever heard of internal condoms and external condoms. External condoms are like male condoms. They go on the penis or on the object of insertion. And internal condoms go vagina or inside the internal intercourse. These are sometimes called female condoms, but because they can be used for anal sex, obviously we all know that not just women are having internal sex, so we call them internal condoms. We also do HIV testing and counseling and education. So we do the rapid HIV test, just like most other clinics. Your results get to you within 5-10 minutes. We counsel you on your options. If you have HIV, we can help you get prescriptions for your medication. If you don't have HIV, we'll counsel you on, like, safer sex practices in the future and things like that. We also do the Hpv vaccine. Although everybody in this group is probably out of the age for getting the Hpv vaccine, it is a really great, safe vaccine that prevents several common forms of cancer that can affect our sexual organs. We also do language services. So if you or someone you're working with doesn't speak English, we do have ways of translating our services into other languages.
And Liam, can I ask something really quick?
Yeah.
Because I know you said telemedicine, and maybe I'm jumping the gun here in terms of asking this, but let's say if I wanted to be a new patient or client to Planned Parenthood, can that be done through a initial telemedicine visit, or does it still require me to have to come into the clinic to sign up for services initially?
You can do it through just telemedicine. When you do the telemedicine through us, it takes about a half hour or so for the whole appointment to go through. And then part of it is like the intake part. So a nurse or a staff person will call you to do the intake information, and then you'll end it with them. And then a few minutes later, one of our physicians or nurse practitioners will contact you to do the actual exams.
Oh, wow. Okay, cool.
Yeah. And pretty much, again, most of our services are covered in this. So STIs, if you have active STI symptoms, we can prescribe you, antibiotics just like we would in the clinic before even running the tests. But we would still encourage you to go get tested at like Quest Diagnostics or something like that. If you want your birth control refilled, we can do that. Your PrEP refills, we can do your PrEP refills through telemedicine. But you would, again, have to go to someplace like Quest to get your blood work done to make sure your lipid levels are okay. And to make, you have to get your HIV test done if you're on PrEP. I don't know if anybody in here is on PrEP or not, but if you are, you know that every 3 months you have to go, I think 3 months, every 4 times a year, you have to go get an HIV test, get your lipid levels done, and I think some sort of kidney test to make sure that's not affecting your liver, your kidney in any adverse ways. But we can do it all through telemedicine, except for obviously the blood test. You get the screening done at Planned Parenthood, then or through the telemedicine, and then you would go to Quest and get your blood work done at Quest. That's who we team up with. We also, so it's not mentioned in here, but we have just recently rolled out doing hormone replacement therapy for trans folk, and that can also be done through telemedicine. So if you need your testosterone or estrogen or whatever, we can do that through our telemedicine programs. Any other questions about our telemedicine?
Nope.
Nope.
All right. Then yeah, we do pregnancy testing and options counseling. So again, if you are pregnant, we will counsel you on your options, abortion, adoption, or raising the child yourself. And we do abortions. We do medical abortions or medication abortions, which are pills that you take at all of our clinics. And then in-clinic abortions are strictly at our West Seneca clinic. STI testing and treatment. So if you get diagnosed with an STI, we will treat it. One really cool thing too is that through telemedicine, if you get diagnosed with an STI, we will also give you scripts for any of your sexual partners who also may have been exposed. So instead of them having to come do a telemedicine appointment and wait a few days for their medication, we can give you a prescription so they can get their medication right away and get rid of any sort of STIs they might have. So that's a really great, really effective way to make sure that we're curbing the spread of STIs really, really quickly. If you do not have insurance, we do have a program called the Family Planning Benefit Program. It's for people childbearing age. It's to help people plan pregnancy better. And it's for any New York resident. It covers most of our services. The income levels are very, very high. Don't quote me on it, but I'm pretty sure it's like $50,000 is the income level cutoff for an individual. And it only works for people who are not already enrolled in Medicaid. If you're already enrolled in Medicaid, our services are covered under Medicaid. We also take all sorts of other insurances. So if you have any sort of private insurance, we have that, or we take those too. If you do use the Family Planning Benefit Program, these are the kind of things you need to bring with you. You need to have your full legal name, your date of birth, a photo ID, you have to know your social security number, and you have to have proof of your income and your address. Again, these are the services we cover with the Family Planning Benefit Program. Advocacy is another great thing that we do. We have volunteers who do a day of action. It was supposed to be this month, where we were all going to go down to Albany and advocate for certain health topics that focus on reproductive care and LGBTQ care and things like that. But unfortunately, because of COVID, that was canceled. We have internships, and then there's a general action, which is a college campus program that pushes for reproductive rights on college campuses. Education is the part of Planned Parenthood that I am part of, and we do education, comprehensive education, age-appropriate education. So I will work with people of all ages, from middle school all the way up to retirement homes. Surprisingly enough, there are a lot of STIs and other sorts of things happening in retirement homes. And so sometimes there'll be like an outbreak of chlamydia or gonorrhea at one of the facilities, and they will call us up to come in and just give a little extra education to the adults there, which can be really weird because they don't really want to listen to me as a 30-year-old, tell them how to have safe sex. But it's really important because for a lot of these adults, they didn't really have very many sexual partners before they got married. And now maybe their significant other has passed away and they don't really have that basic knowledge of, protecting themselves from STIs. They only worry about pregnancy, which they can't get pregnant anymore because they're too old, or they're not having that kind of sex. And so they don't think about gonorrhea, chlamydia, syphilis, and things like that, which, doesn't matter what age you are, you can still be infected with any STI if you're having sexual intercourse that, involves the exchange of bodily fluids with each other. We also encourage parents to talk to their children. So we do parent classes to teach parents how to talk to their kids about sex. We do something called Askable Adults. We actually are just finishing up a really cool grant that focused on the Latinx community and talking to people in the Latinx community of Buffalo about how to talk to their children, about having, doing the sex talk with their children in a healthy, effective way for age appropriateness. We work in a bunch of different locations too. We do schools. Most of my work is in schools. We also do faith-based organizations, youth agencies, parent organizations, group homes. One of the things that I actually work really hard on is working with people with developmental disabilities and helping them through any sort of sexual kind of things that they're dealing with. community agencies, obviously, one-on-one sessions, and pretty much anywhere. If people want to work with us, we are happy to work with anybody. The only place we don't really like to go is people's houses. The things we talk about are all over the map. Planned Parenthood services, what I'm talking to y'all about right now, anatomy and puberty, healthy relationships, birth control, STIs and HIV, safer sex, LGBTQ awareness. I always try to talk about LGBTQ folk whenever I'm teaching at schools. We do this really awesome thing where, you know, we just go through kind of the basics of like, what is gay, what is bi, what is pan, what is lesbian, what is queer, things like that. I don't know if you guys ever saw the gender unicorn, but it's kind of like this unicorn. But, pardon? Yeah. And it's like this unicorn that kind of goes through the different parts of our identifications as we might identify ourselves. And so we'll have like sexuality, whether I identify as like gay, straight, pan, bi, whatever, or asexual. Then we have like gender identity. So how you identify gender-wise, either, you know, trans, queer, whatever. Sexual attraction, gender expression. So how do you express your gender identity? Things like that. And we kind of talk about how, you know, they're all different. Just because you may, maybe you're a trans woman who likes women. You know, it's your decision, is how you feel, right? And so we talk about how we don't like to label people with words like, oh, if you're a trans woman who likes women, then you're definitely a lesbian or you're definitely straight. It's more for other people to identify themselves how they want to identify. And so I never really say like gay men need to do this or lesbians need to do this. Because if I say things like that, it really like kind of narrows down my focus, because maybe somebody I'm talking to is a man who has sex with men but doesn't identify themselves as gay, and I don't want them to kind of tune me out or ignore me because they think I'm only talking to gay people. And then we have some peer education groups. Teen Reality Theater is a theater group that we have in Buffalo that goes around and they write their own theater performances, and they also you know, do other performances at schools, after school programs. They write poetry. Right now, because of COVID, they're doing online videos and things like that. So TikTok videos. I don't know if you guys ever watch some TikToks. We have a bunch of TikTok videos out and things like that. And then we have a youth drop-in center in Niagara Falls that's really awesome, but unfortunately closed right now, again, because of COVID. All right, and that's pretty much all of our services. I'm gonna stop sharing the screen. Do you guys have any questions about Planned Parenthood or the services we provide? And I mean, a lot of this information you guys might not be using directly, but if you need it professionally, if you work with people of you know, different populations, if you work with youth, please feel free to like hit us up for educational resources. We also help youth if they need like housing or something. So if one of our kids comes to us and tells us that they need help finding a house because their parents are like abusing them or something, we help them find houses. We work with crisis services. We work with Home Space and all sorts of other amazing organizations to kind of make sure our youth are safe. I do a lot of work with youth. So mostly what I work with are people between the ages of 12 and 21. But I work with people of all ages too.
Liam, am I pronouncing your name properly, Liam?
Liam.
Liam, sorry.
No worries.
I have a question. Do you work strictly for the Pride Center? And also, second part of the question would be, how is Planned Parenthood funded? Is it all donations, or is it grants, or government supported or not government supported?
So that's a great question. I work for Planned Parenthood. We team up with the Pride Center for a lot of stuff. And we also team up with GLIS, the Gay, Lesbian Youth Services, to do a lot of programming. But Planned Parenthood is the one who pays my bills and writes my checks. And so the way I get paid is through grants. New York State especially has this grant called CAP, Comprehensive Adolescent Pregnancy Prevention Program. And they pay most of my salary. The federal government used to give us a grant called Title 10 that would cover some of the other education I do that wasn't covered by CAP. But because of certain administrations changing rules on things, we no longer receive that funding. So about 10% of what I do isn't funded by anything right now, unfortunately. For our clinics run mostly off of insurance. So any sort of services we provide, we charge insurance, Medicaid, Medicare, independent health, Blue Cross Blue Shield, things like that. And so that's where the clinics make their money. Advocacy, it has to be its own separate thing because so I can't like go and advocate or like lobby politicians because of me receiving money from government organizations. And so our advocacy organizations run mostly on donations from people. So if you donate to Planned Parenthood, a lot of that money goes to our advocacy programs. And if you're interested in supporting Planned Parenthood, you can go to plannedparenthood.org and donate directly to Planned Parenthood, or you can donate to ppcwny.org and donate directly to us.
So I have a question about, let's see, the medical services piece. So it seems like, and maybe maybe I heard it incorrectly, but it sounds like a lot of the stuff that you guys offer are ancillary services, but you're not like a primary medical provider. Like, could I come in and see a doctor for just regular health stuff, or would I be primarily just coming in if I had more sexual health questions, or if I needed, let's say, like hormone treatment? Like, I could get that stuff there, but primary care is you would have to get somewhere else.
Yeah, so some people do use us as their primary care, but we're not technically a primary care doctor. So like women especially, they use their OBGYNs as their primary care. And so they use our OBGYNs as their primary care at the same time. But like if you had like a cough, you called us, we probably would say, hey, you actually need to go someplace else because that's not really what we're going to deal with.
Gotcha. Okay. Cool.
Any other questions?
Anyone else? Going once, going twice.
Hello.
Oh,
Yeah.
Mark, yes.
Hi. Now that COVID, or rather, the coronavirus has been found in semen, are you recommending sex be with a barrier method, but oral sex?
Yeah, definitely. So actually, when COVID first came out, I was doing, I did an education session about COVID and sex. And New York State's original guidance said that it wasn't in semen. So I was telling people, it's in rectal fluid, but it's not in semen. So take precautions. But also, we were recommending really not having sex with people that you're not quarantined with already, because when you're having sex, right, you can't really stay 6 feet apart unless you guys are like, doing like mutual masturbation or something where you guys are just watching each other. So already we were saying like you shouldn't be going out having sex with people unless you're quarantined with them. If you do, definitely don't make out with each other because it's spread through kissing and saliva. And now, yeah, we would recommend using condoms too. But again, we would recommend using condoms no matter what, because of the other STIs that you might be able to contract through sexual intercourse with someone you're not already quarantined with. And one really interesting thing, New York State, when COVID first happened, they sent out this like guidance for sex, which was really, really great and helpful. And they actually talked about people in the sex work industry. So they encourage people who are part of the sex work industry to start doing solo things and do more online stuff. So they encourage them to do like fans only pages on Instagram or like Patreons where they just like kind of record themselves, doing things. And I thought it was really progressive of New York State to kind of offer that guidance to people who maybe are not doing jobs that other people would consider work.
Thank you.
Thank you.
Any other questions? Liam, if anybody did have questions, do you mind sharing with us an email address or a phone number that people can contact you or reach you at?
Definitely. I will drop both in the chat area.
Okay, perfect.
And yeah, if you have questions for me about anything, definitely feel free to contact me. And again, even if it's not for you, if it's for a family member, a kid, a child, I don't know what you guys all do for jobs, but if you're working with clients or anything that need our services, reach out to us. We are happy to serve anybody, anytime. My coworkers and I are very, very dedicated to this line of work.
Perfect. All right. Oh, perfect.
All right. So I dropped my email and my phone number in the chat box. And one last thing before I go, if anybody's free tomorrow or bored and wants to enjoy listening to me talk today, me and my coworker Lynn have a weekly YouTube show where we discuss different things we saw in the news about sex. So tomorrow we are going to be talking about some of the articles. I don't want to spoil it because the articles are usually pretty funny. So we'll be talking about different funny topics and articles that we saw in the news this week. So if you want to check it out, Planned Parenthood of Central and Western New York YouTube channel, it'll be on there. And Ron, you have the Connections Facebook page, right? It'll be shared on there.
Yes.
If you want to share it to your Facebook page, feel free. It's a pretty funny thing that we do. I think you guys will enjoy it. So check it out if you are bored and want, a half hour of comedy.
Very cool.
What time is that on?
We usually will release it around 2 or 3 in the afternoon.
Okay.
But it'll be on YouTube, so like anytime in the afternoon, probably definitely before 4 o'clock.
Okay.
Cool. So, all right. Well, if there are no other questions, Liam, thank you so much for coming tonight and for presenting. There was a lot of great information that I didn't realize Planned Parenthood did in terms of services. And the fact that you guys are doing a lot of those services by telemedicine is absolutely phenomenal. As a licensed mental health counselor and just like having had that experience in the realm of telemedicine, the fact that you guys are able to do that and expand it is huge for a lot of people. So kudos to you guys for doing that. So
definitely. Thank you for letting me come on. And I know we talked about having it be like really our service is focused on LGBTQ community, but I hate to like assume that someone like, I'm not going to talk about birth control because maybe lesbians don't need birth control, but I don't want to assume that, right? Because there's a lot of different reasons why people might be taking birth control. Trans women sometimes take birth control, or trans men, sometimes take birth control to stop their periods because having a period can be kind of like body dysmorphic. And so I didn't want to like just talk about like queer issues.
no, I think everything that you brought up was perfect. So it's awesome. Definitely thank you so much for doing that. I hope everyone got some out of tonight's presentation, and thank you for sharing your contact information. So if anybody has questions, I'll definitely promote that, and we'll be posting the video on Facebook and sharing it with members as well. So if anybody missed it and wants to tell their friends, oh hey, we just had this great presentation from Liam and Planned Parenthood, we'll be able to share that link as well. So
awesome, definitely. And if you want to tag me in it, feel free. I'll then like if anybody has questions, like they can comment questions and I'll answer the questions in the comment box too.
awesome. Very, very cool.
Yes.
So, yep. All right. Anybody?
Thanks, everybody. Thank you for letting me take up some of your time. I really appreciate it.
Thank you.
Have a good one.
Thank you.
All right. Bye-bye now.
Bye.
All right, guys, if you just want to give me 1 second here, I'm going to